Okay, hi. Today's anatomy topic is a little bit diverse. We're talking about body planes, body positions, as well as directional terms. Okay, first, so body planes. There are three body planes that we're going to talk about here. We have the transverse plane. The transverse plane is something that is going to cut the body, not literally, but divide the body in a figurative way so that we could see the inside in a transverse way. So that means horizontal transverse. When we cut the body or imagine cutting the body in this way, we divide the body into a superior and an inferior part. The next body plane we're going to talk about here is frontal. Frontal is like this. Think about separating the front of the body from the back of the body. Okay. Another term for the frontal plane is the coronal plane. Okay. The frontal plane is going to separate the body into an anterior half and a posterior half. And then the third one here is the sagittal plane. Okay. The sagittal plane is going to cut the body this way, and it does not have to be directly in the middle. It could be to the side. I'm just going to cut the body into a left and right half. Okay, so imagine whenever we use any of these planes, a sagittal, a frontal, or a transverse, that we are separating the body into two halves and then looking at what we see along those lines. When an MRI or a CT is performed, the machine is doing those slices, and then the doctor is going to put them together and to create a 3D image. Okay, so here another view of the frontal or coronal plane. Again, you can clearly see here that with a frontal or coronal plane, not like this would be sagittal, frontal coronal like this, it separates the body into an anterior and a posterior part. Here we can see a clearer version of the transverse or the horizontal plane, separating the body into a superior and an inferior part. Here we see sagittal. Remember I said it does not have to be straight down the middle. That would be mid-sagittal. That could be along the side, anywhere along the side, and anything that is not mid-sagittal is referred to as parasagittal. And a sagittal plane divides the body into left and right halves. And then missing from that earlier picture, but also important, is an oblique plane. An oblique plane is anything that comes at any kind of angle, meaning it is not going to be horizontal and it is not going to be vertical. So any other plane. Okay, some body positions. First, anatomical position. Anatomical position is what you see down here. Anatomical position has many key features, and the body is upright. The face is pointing anterior forward. The toes are pointing anterior or forward. The palms are pointing anterior or forward. However, I could have my palms facing anterior and have my hands like this. That does not mean I'm in anatomical position. I'd have to have my hands like the diagram shows, my arms at my side and my palms anterior. So not like this with my arms at my side. Okay. Also notice that the legs are slightly apart, about shoulder width apart, face anterior, palms anterior, toes anterior, and the arms at the side, okay, and standing upright. Why do we use anatomical position? So we have a standard frame of reference to refer to anything. If I say the eyes are superior to the nose, that's true. It doesn't matter if I'm laying down. It doesn't matter if I'm standing on my head, because in anatomical position, my eyes are in fact superior to my nose. Okay, so it's again a frame of reference that will be used forever in anatomy, okay, in this class. The other two main body positions, you have supine and you have prone. Supine, lying down position with face up. Prone, lying down position with face down. I remember it because supine has the word up in it. So supine, your face is up. Now we have a whole bunch of directional references. Okay, we hinted at a lot of them already, but we're going to go through them in a little bit more detail here. Okay, and superior. Superior means closer to the head. Okay, so the eyes are superior to the nose. Okay, the chin is superior to the shoulders. Inferior means closer to the feet. The mouth is inferior to the nose. The sternum is inferior to the forehead. Okay. Now we have anterior and posterior. Anterior meaning closer to the front of the body, posterior meaning closer to the back of the body. It does not mean that it is on the front of your body or on the back of your body, just in a reference. So, for example, the nose is anterior to the eyes, closer to the front. The ears are posterior to the mouth. The sternum is anterior to the spine. Okay, so again, positional reference for front and back. Another term for anterior is ventral. Another term for posterior is dorsal. I remember the dorsal one because the shark has a dorsal fin. Okay, another term for superior is cranial or cephalic, and another term for inferior is caudal. All right. Now, there's right and left. Remember, we're always thinking about the body in anatomical position. So it's the right and left of the person I'm looking at. And then we have medial and lateral. Medial is going to need you to imagine a line drawn down the center of my body, through my nose, down through the sternum, through the belly button. And medial means that it's going to be closer to that midline. Lateral, meaning it is further away from that midline. So my nose is medial to my eyes, closer to the midline. My ears are lateral to my nose, further away from the midline. And then we have distal and proximal. Okay. Distal and proximal only refers to positional locations on a limb. Okay, so I'm talking about my arm and their relationship to where they are on the trunk. So the arms attach to the trunk at the shoulders, the legs attach to the trunk at the hips. So anything that is closer to the shoulders will be proximal. Anything that is further from the shoulders will be distal. Think distant, further away. Same with the legs. Anything closer to the hips will be proximal. Anything further away from the hips will be distal. So my fingers are distal to my wrist, further away from the shoulder. My elbow is proximal to my wrist, closer to the shoulder. My knee is proximal to my ankle. Okay. My ankle is distal to my hips. Right? So again, we're comparing in relation to the body. One last one to address is superficial and deep. Superficial, closer to the surface of the skin, deep, further inside. So my skin is superficial to my muscles. My bone is deep to my skin. Right? So relationship to the surface of the skin. And here is the list of all of these terms. Inferior, toward the feet. Superior, toward the head. Medial, toward the midline. Lateral, away from the midline. Proximal, closer to where the limb attaches to the body. Distal, further away from where the limb attaches to the body. Anterior, closer to the front. Posterior, closer to the back. Superficial, on the surface. Deep, further in from the skin.